Phase 2 of ease of lockdown.
Federal government to flag off Abuja, Kaduna and Kano gas pipeline project today.
National Assembly leadership holds planned increase in electricity tariffs.
And on Good Morning Nigeria today, we shall discuss COVID-19 and the latest guidelines.
Since the announcement of the index case of COVID-19 in February 2020, the federal government and the subnational government took proactive steps to prevent the spread of the virus.
Now, part of the steps taken include total lockdown of some highly infected states, such as Lagos, Ogun, and the Federal Capital Territory, as well as some local government areas, the ban on interstate travels, and the imposition of 24-hour curfew, as well as the wearing of face masks.
Exactly, Kingsley. Other measures are washing of hands with water or sanitizer, ensuring physical distancing, and ban on mass gatherings, as well as closing of places of worship and workplaces, except those on essential duties.
Now, to also create a balance between the wealth and health of the citizens, the federal government reviewed the strategies and then relaxed the lockdown in phases.
And as the Phase 2 of the gradual easing of the lockdown, which began on 2nd of June, ended yesterday, the federal government extended it for another 4 weeks after due consultations with various stakeholders with little modifications.
Now, some of the amendments as rolled out by the Presidential Task Force on COVID-19 include reopening of domestic aviation services as soon as practicable, and the reopening of schools to allow students in graduating classes to prepare for their examinations.
And Kingsley, that is not all. The task force also announced the resumption of interstate transport services with noticeable compliance to safety guidelines to be enforced by state government, but such travels must be outside the curfew hours with effect from July 1st.
Yeah, but what is paramount now, Jumai, is that the PTF emphasized the need for Nigerians to use face masks, pointing out that no mask, no service or attention in any government office.
And the PTF chairman and secretary to the government of the Federation, Boss Mustafa, while giving a rundown of the guidelines, said the extension of Phase 2 of the gradual easing of the lockdown was as a result of non-compliance with the laid down rules despite massive risk communication.
So how will this extension help in reducing the spread of COVID-19, especially with community transmission? And what strategies should also be available to ensure compliance with the laid down guidelines? And how soon will aviation services resume? And are security agencies and state governments fully ready to enforce the guidelines? Are we likely to see stiff sanctions for violators of the guidelines? It's Good Morning Nigeria, and I'm Kingsley Osadolo. I welcome you to today's edition of the program.
I am Jumma Yusuf. Thanks for joining us. We are reaching you live on the network service of the Nigerian Television Authority, the NTA, and from the nation's capital, Abuja. We have our complimentary segments of the program, but first, let's join Ifoma Ojinto for the morning news. Good morning, Ifoma. It's been a while.
Good morning, Jumma. It's nice to see you today. Good morning, Kingsley, and here is the morning news. The Nigeria Center for Disease Control has reported 566 new cases of COVID-19 as at Monday, the 29th of June 2020. The breakdown of the figures shows that Lagos State has 166 new cases, Oyo has 66, Delta 53, Ebonyi 43, Plateau has 34, while Ondo has 32. Others are FCT with 26 new cases, Ogun 25, Edo 24, Imo has 15, Bayelsa 13, Benue has 12, while Gombe, Kano and Kaduna have 11 each, and Kwara has 20. Similarly, the NCDC has reported 8 new cases against Osun, Nasarawa has 7, Borno 5, while Katsina and Anambra states have 2 each. Currently, Nigeria has 25,133 confirmed cases of COVID-19, with 9,402 of them discharged and 573 deaths. All is set for the presidential flag-off of the construction of the Ajaokuta-Kaduna-Kano AKK gas pipeline. The $2.8 billion project, which is in 3 phases, is expected to be flagged off by President Muhammadu Buhari. The event is expected to take place today at Ajaokuta and Kaduna. The AKK is the biggest gas pipeline project in the country, with a 24-month completion period. The leadership of the National Assembly has waded into the controversy on the planned hike in electricity tariffs from 1st of July 2020 and succeeded in convincing the distribution companies to defer the plan to the first quarter of 2021. In a statement by the Special Advisor to the President of the Senate on Media and Publicity, Ola Awoniyi, Senator Lawan, the Speaker of the House of Representatives, Femi Gbajabiamila, and other principal officers of the 2 chambers met at the National Assembly with the chief executives of the government electricity regulatory body and discos across the country. Also in attendance were the chairmen of the committees on power from the Senate and House of Representatives. The National Assembly leaders were emphatic at the meeting that the timing of the planned hike was wrong, even though they had not much issue with the need to introduce cost-reflective tariffs for the power sector to attract the much-needed investments. And as government and other stakeholders continue to seek solutions for a more effective border management in Nigeria, Vice President Yemi Osinbajo said renewed efforts will be channeled towards improving synergy amongst agencies involved in border management. The Vice President said this during a virtual presentation of the research report of the National Defense College Course 28, titled Border Management and National Development in Nigeria, the ECOWAS Protocol relating to free movement of persons, residents and establishment in perspective. Vice President Osinbajo said border management affects the economy very considerably, hence the need to get all agencies involved in the sector together. While commending the participants for a thoroughly researched paper, the Vice President said the research paper touched on important national issues and that efforts will be made to adopt and implement key recommendations. The report identified the lack of coordination as a major weakness in Nigeria's border management, while key recommendations include the adoption of a comprehensive border surveillance program, the creation of National Border Management Service, amongst others. With all the political melodrama that ushered in party primaries, submission of candidates by political parties for the Edo governorship election has ended Monday. INEC National Commissioner for Information, Festus Okoye, revealed this at INEC headquarters in Abuja.
15 that indicated interest conducted party primaries, and we monitored the party primaries of 15 political parties. At 6 p.m., we shut down the portal, and nobody can submit anything again. So no extension? No extension whatsoever. So by the 6th day of July, we are going to publish the names of all the nominated candidates in Edo State, in Benin City specifically.
In the meantime, All Progressives Congress Caretaker and Extraordinary Convention Committee has been inaugurated. Chairman of the committee and Governor of Yobe State, Mai Malabuni, assured of a leadership that will practically demonstrate the desire of APC to create a prosperous future for the nation.
What happened to us as a party in the last few months is not totally strange in a big political party such as the All Progressives Congress. I urge all party members to heed to the appeal by our leader, President Muhammad Buhari, GCFR, on his call to all aggrieved members who have instituted various cases in the courts to please withdraw such cases in the interest of our great party.
That's the morning news. The program continues with Kinsley and Jumai after this break.
If you are just joining us, this is Good Morning Nigeria. COVID-19 continues to take toll on businesses. Let's join Kunle Ade for details.
Restriction placed on movements, especially ban on interstate travel as a result of the coronavirus pandemic, has had effects on consumers and sellers. Some categories of businessmen hit by the low purchasing power of buyers are the telephone vendors. A recent survey conducted by a Nigeria-based fintech shows that phone and other allied products vendors have lost about 30% of their invested capital to the economic impact of COVID-19. A visit to the famous telephones market in Abuja, known as the GSM Village, confirms the development.
Honestly, this COVID-19, it will little deal with us. Even many guys in this market itself, some people maybe with a little amount they are even doing business. After the lockdown of this itself, now the business collapsed. And many people are not buying phone now because they were locked down. Many of them are not coming out. Instead of them to money to buy phone, they save it and buy food first.
Now we have days of opening, Monday, Wednesday and Saturday, and we have time of closing also. So all those times, many customers do come during time of closing. You know, many government workers, they come during time of closing by 4 or 5. But now we don't do business again with them. Everything is rush up, and we'll go home.
And next are the details of Monday's tradings on the floor of the Nigerian Stock Exchange. With business news, I'm Kunle Ade.
Many thanks, Kunle Ade, for the business package. Coming up next is newspaper review.
Our newspaper reviewer, Bayo Toby, is in the studio. Good morning, Bayo.
Thank you, Juma. Good morning. Good morning, Kinsley.
Right.
Good morning, Nigeria.
Bayo, good to see you.
Good to see you too.
You see him every day. Well, we're beginning the newspaper review this morning with the Daily Sun newspaper. And the airpiece beside the masthead, Army Chief relocates Sokatsina as banditry attacks escalate. That story is on page 5. And just below the masthead, Nigeria protests auction of sacred statues in France. You find details of that story in page 3. The bold headlines there: teachers protest as FG reopens schools. With riders SS3, JSS3 students, primary 6 pupils to resume. Interstate travel ban lifted, flight begins soon. Curfew extended by 4 weeks in Abuja and Lagos. You also find details of these in page 6 and 8. And the picture story there, which is a sad trend happening across the country, very disturbing one. Kidnapped kids rescued by Special Anti-Robbery Squad SARS in Abuja yesterday. Deputy Commissioner of Police Abakari parading suspected kidnappers in Abuja yesterday. And another alarming story there: violators of restriction order against night clubbing arrested by the COVID-19 Ministerial Task Force in FCT, sweeping the street as punishment in Maitama, Abuja yesterday. And just below the picture story, government considers total lockdown of 18 local government areas contributing 60% of COVID-19 cases. With a rider, 3 deaths, 24 health workers infection frightening, says Ebonyi State government. You find details on page 6 and 28. Court orders Bajabia Miller, NASC, to disclose cost of newly purchased 400 cars. That details on page 26. APC Caretaker Committee tells aggrieved members to withdraw all suits. With rider begins reconciliation process. That story is on page 26. Seized funds. EFCC releases 1.25 billion naira to Benue ASO Savings and Insurance Firm. Details on page 26. Court dismisses certificate forgery suit against Obaseki. Find that story on page 28. Kingsley?
Okay, we also take a look at the front page of the Nation newspaper. Above the name flag, we'll take two of those headlines. Buratai, I'll remain in Katsina to battle bandits. That's on page 6. Kogi CJ's death raises issues on state's virus status. That's page 3. And below the nameplate, you have Edo 2020. That's the governorship election. Certificate forgery. Court strikes out suit against Obaseki. APC seeks support for Isaiah Yamo. And ADC confident. Ministers, CSOs canvass peaceful election. You find details of those stories on page 28. Electricity tariff hike to wait as Lawan and Bajabi Amila intervene. Discos seek payment of difference by government. That story is on the front page with a jump to page 8. Lead story on coronavirus comes with a kicker, COVID-19. 18 councils with 60% of cases for lockdown. Lagos, Abuja, Edo, and others top list. Other measures. Final class pupils, that should be final year class pupils, to resume for exams, safe resumption of airports for flights, lift of ban on interstate travels, enforcement of no face mask, no service. Oil prices rise on improving data, and then you see the sidebar there, the figures from around the world and also for Nigeria. Now we have 25,133 cases, fatalities 573. Those cases that are still active, 15,158. And around the world, over 500,000 persons have died, and those who have recovered, 5.6 million, but total global infections, 10.3 million. And then the photograph on the front page shows some kidnap and robbery suspects while they were paraded at the force headquarters in Abuja yesterday. They've been busted. APC to begin reconciliation, that's page 8. El-Rufai raises panel on Zagon Kataf crisis, also on page 8.
Well, let's start with the ease of lockdown. Another 4 weeks of ease of lockdown has been extended, and this will span from 30th of June to 27th July. In this second phase, however, there will be reopening of schools only for exiting students, that is students in primary 7, JS3, SS3. The intention is to ensure that they resume classes in preparation for their exit examination so that they don't lose academic year. The chairman of the Presidential Task Force explained the conditions in the next phase of the second phase of the ease down. He says we are to maintain the current phase of measures for health controls, and also pupils and students in graduating classes will resume. Schools will remain, other schools are to remain closed. However, pupils and students are to be compelled to wear face masks and observe health protocols. The reopening for the exit pupils is to enable them sit their examinations so that they don't lose an academic year. Other measures are the lifting of the ban on interstate travel. However, the curfew still maintained between 10 p.m. and 4 a.m. Resumption of local flights are being contemplated. However, if you are intended to travel, you need to be at the airport 3 hours ahead of time. This is to enable you go through the rigorous process of airport protocol to ensure that COVID-19 does not sneak through. NPower opened is for batch C registration on June 26, that is last Friday. Already about 1 million candidates have said to have been registered. This means that batch A and B are now to be rested. However, the Ministry for Humanitarian Affairs, Disaster Management and Social Development says that those who have not received their outstanding stipend will be paid. The delay was caused by the transition from the former payment system to the GIFMIS, Government Information Management and Information System. There are two critical developments that is very of interest, particularly to peace. The first one is in Kaduna State, where the Governor Nasir El-Rufai has appointed a committee of permanent secretaries to look back into true and provide white papers on two reports about Zango Kataf crisis. It may be recalled that in 1992 there was a Zango Kataf crisis, in a process in which about 82 persons were killed. And in 1995, another 1,520 persons were killed in Zango Kataf, 305 in Zaria, Ikara, and in other places. These were violent clashes that have been predicated on conflict over land between the Atiab and the Hausa natives around Zango Kataf. Now, two administrations had appointed panels. The first was Rahila Kujo panel that investigated and provided a report. It had been living on the shelf, it has not been implemented. Later on, the military administrator Jafar Issa also appointed Air Vice Marshal Muazu, who was a former governor, to also bring out a panel of reconciliation. The recommendations were not implemented. June this year, clashes broke out there again, still on the same crisis, and therefore Kaduna State government has appointed this committee to put an end to this recurring crisis once and for all. The other development relates to issue of ghost workers in Niger State. You will be shocked to find out they have discovered 5,000 ghost workers on the payroll of the state for over 30,000. And the committee set up and headed by the Commissioner for Works and Infrastructure revealed that for every of the 1,000 workers that they screened, they found about 250 to 300 ghost workers. And guess how they did some of the things they did? The committee found out that 6 people will have about 6 BVN numbers. One person will have 6 BVN numbers. Some of the retired workers were still on the payroll. And some of these retired workers were still on the salary, the receiving salary continuously as if they are in work service and also taking pension.
How does somebody get 6 BVN numbers?
It's a puzzle.
All accounts are supposed to be interconnected, I
When
think.
you use different names,
Okay.
you can have 6 different BVN. But those who use the same name, and there were multiple names, BVN revealed them because BVN eventually showed that they belong to the same persons. That's why they were able to discover them.
Yeah, one way to bust that ultimately will be the national identity card. Yeah. Once you have your national identity card and your BVN should be matched. To say if you're opening an account, let's have your national ID card. And your particulars and details on your national ID card will go along with your BVN when you're opening your bank account. Forget about international passport, forget about driver's license, just get your national ID card. So let the details go in there so that we'll see how those who want to have multiple identities can still get around to doing that. The other point, you recall we were discussing it yesterday on the proposed electricity tariff hike, which is supposed to take effect from tomorrow. It's heartwarming that the Senate President and the Speaker of the House have now intervened, but the writer to that headline is saying discos are seeking payment of difference by government. It's a point of curiosity because government itself is a shareholder in the discos. So, how does government exercise its shareholding power as a minority or otherwise in a discourse? You are saying government now should come and pay the difference. Pay the difference to whom? To the majority.
Pay the difference.
I mean, you're saying that the government itself is a shareholder. I'm just talking about the governance mechanism of the discourse because each time the discourse are being lambasted for the poor quality of their services, lack of meters, and so on and so forth. While the government, of course, is also there, is the management of discourse that we are faced with. But what is the role of the shareholders? Have they ever called a shareholders meeting? And if they did, what were the issues that were discussed at those shareholders meetings that took place? Because if your business is not going on well, we read the editorial yesterday saying, look, government should revisit the privatization exercise. Exactly what is playing out. I mean, you just have shareholders who are sitting at the back and then watching to see how their businesses are being run aground, as it were. Yes. So what should be the role of shareholders in this particular instance? You have privatized, fine. Government, you hold your shares, not controlling shares, by the way, but even as a minority shareholder, you have your rights.
Yes.
So I think it's a point of curiosity, how we're going. Otherwise, people just wake up and say cost-reflective tariff. You are reflecting darkness and you're asking people to pay for darkness.
Yes, and the common man will suffer for it all at the end of the day.
Yeah, the other point is, the Chief of Army Staff says, I remain in Katsina to battle bandits. Fine. The Chief of Army Staff had been in the northeast for quite some time. Now he's relocating to the northwest.
For 2 months.
You're going to ask yourself, how long is he going to stay at various locations, various hotspots, just rotating, going around the country? That tells you the level of the security challenge that we are faced with. For security experts, that should call for a review of the strategic approach to dealing with this insecurity.
Exactly.
Absolutely, because it's getting overwhelming. Because what you now have is that, you recall just last week we had a report about the resurgence of the kidnapping on the Kaduna-Abuja highway. And this is in spite of the fact that the Nigerian Air Force, in its wisdom, has a kind of heliport along the highway where it can go for SOS emergency calls so that they can stem it. But gradually, these kidnappers we thought had been taken care of are now coming back gradually again.
We had something like that in Maiduguri a long time ago on that notorious Damboa-Abiu road during the military. The helicopter was always hovering, and it sort of gave a safety net for the passengers on the road. If that could be done, I think it would sort of bring down the banditry along the northwest area.
Yes, it will, because it is the same strategy that the Nigerian Air Force is adopting with for the challenges with the banditry, especially in the northwest. That's why, in the wisdom of the Chief of Air Staff, they've now constructed a hangar in Katsina, and they are providing facilities there. In fact, they are also providing, I think, airstrip within one of the forests to enhance the rapidity of the Air Force invasion in that area. If the military strategy is you dominate the area.
Yeah.
When you dominate the area, then the criminals will have very little area to hide.
We hope so. And let's now go to the editorial. It's coming from the Nigerian pilot. Urgent attention on malaria resurgence. I just want to read a little. Regrettably, most victims of malaria pandemic are children. According to data from WHO, 57% of malaria fatalities are children younger than 5 years old. The statistics further averred that malaria is one of the leading causes of child mortality, as every 12th child that died in 2017 died because of malaria, thus requiring urgent action from relevant authorities. COVID-19, malaria, and also on. It's overwhelming, actually.
Yes, malaria resurgence, the editorial is happening on the fact that because the national and worldwide attention is on COVID-19, apparently malaria, which is also a big challenge, has been gradually swept under the carpet. And the concern in the editorial reflects on a report from Kaduna, which has showed that malaria is currently killing more people than COVID-19. Yes. And the concern here is that even worldwide, 25% of worldwide malaria is located in Nigeria. DR Congo has about 11%, Mozambique 5%, India about 4%. And there has been an attempt to follow a plan of worldwide eradication of malaria. The approaches are two. One is containment in environment that breeds mosquito. The second is a genetic approach, whereby the female Anopheles mosquito, that is the carrier that causes the malaria, should be targeted in such a way that it can, a system that can eliminate it. But unless that is done fully, malaria will still continue to be a challenge. Currently, the danger is that because there is a similarity between COVID-19 and malaria, when people have malaria, they are afraid to go to hospital because of COVID-19.
That's right. Okay, Bayo Achebi, we'd like to thank you. I think you already mentioned the measures that the government has rolled out in terms of the further relaxation of the lockdown. I think the Presidential Task Force on the federal government should be commended for now asking pupils in their exit classes, primary 6, JS3, and SS3, to resume so that they can take classes and then write their graduation exams. I think that's a very significant step, a very significant step, while we watch out and see how the virus either spreads or begins to fall in terms of infections. Bayo Achebi, I'd like to thank you for being around. We'll see you again tomorrow.
Thank you.
It's Good Morning Nigeria live on NTA's network service. We're taking a short break now. When we return, we shall of course be focusing on the latest measures rolled out by government with regard to managing the coronavirus in the country.
You're welcome back, and to begin our discussion on the gradual easing of the lockdown and highlights of the new guidelines, let's watch some excerpts from the PTF briefing put together by Abdulmalik Adiwu.
Given the challenges and the visible danger ahead occasioned by skepticism and poor public perception, both leading to lack of compliance, it has come to the inevitable conclusion that the extension of the phase 2 of the eased lockdown will be needed. However, the following measures shall either remain in place or come into effect. 1, maintaining the current phase of the national response for another 4 weeks. 2, permission of movement across state borders only outside coffee hours with effect from 1st July 2020. 3, enforcement of laws around non-pharmaceutical intervention by states, in particular, the use of face masks in public places. 4, safe reopening of schools to allow students, only students in graduating classes, resume in person for preparation for examinations. 5, safe reopening of domestic aviation services as soon as practicable. 6, publication of revised guidelines around the 3 thematic areas of general movement, industry and labor, and community activities. 7, provision of technical support for states to mobilize additional resources for the response. 8, strengthening partnerships with states, local governments, traditional rulers, community and religious leaders, and civil society to ensure increased public awareness and compliance with preventive guidelines. 9, encourage state governments to empower local government authorities to intensify contact tracing efforts and ensure stronger grassroots mobilization to support the response. 10, encourage states and hospitals, authorities to particularly ensure continuity of other health services to prevent fatalities from other life-threatening conditions during the COVID-19 pandemic. And 11, deepening of collaboration with other groups at state and federal levels to harmonize the country's COVID-19 response in the short, medium, and long terms.
All right, that was the background there, indicating that the measures already rolled out by the Presidential Task Force, chaired by the Secretary to the Government of the Federation. Joining us now to discuss matters arising, we'd like to welcome fairly familiar faces on Good Morning Nigeria with us here in the Abuja studios. Professor Abdulsalami Nasidi is Provost College of Health Sciences, University of Africa in Bayelsa State. He's also Vice Chairman, FCT Ministerial Experts Advisory Committee on COVID-19. And by the way, former Director General of the NCDC. Prof, pleasure to have you on the program.
Thank you very much.
All right. And also from our Kano Network Center, I've been joined by another familiar face, Professor Isa Sadiq Abubakar, who is Director, Center for Infectious Diseases Research at Barrio University in the ancient city of Kano. Prof, pleasure to have you with us this morning.
It's my pleasure too. Good morning, Nigeria.
And joining us via Skype from Owerri is Professor Maurice Iwu, Chairman, Imo State Task Force on COVID-19. Thank you so much for joining us.
Thank you. Good morning.
Also joining us via Skype is Dr. Sani Aliu, National Coordinator, Presidential Task Force on COVID-19. It's a pleasure to have you join us.
Good morning.
All right, let's begin a conversation with Dr. Sani Aliyu. Dr. Aliyu, once again, welcome to Good Morning Nigeria. But lead us into the source of the confidence of the Presidential Task Force in rolling out the latest guidelines, which of course encompass the return to interstate travels, of course, within the time boundaries other than night travels, as it were, the reopening of schools and all others, and of course, shifting the responsibility, as it were, to the subnational entities. Why are you so confident that this will work this time?
Thank you. So, as we know, the entire national response is really based on the concept of science, data, and the evidence base we have when it comes to the control of pandemics. The decisions we take are decisions that are scrutinized very carefully by members of the PTF. We have a large team of researchers, academics behind us that help us with modeling studies that enable us to decide which way to go. It doesn't take. It's very clear that the numbers are going up. There's no doubt about that. It's also very clear that the level of compliance with some of our protocols and guidelines is not as high as it should be. And as we all know, this is a respiratory viral infection with no vaccine, no preventive therapy. So the only way that we can get on top of this is to modify and change behavior. But change of behavior would involve going right down to the grassroots, which is why we've taken some of the decisions we have taken. In terms of a general lockdown, we have gone through a lockdown in 3 states and the FCT before. For Lagos, Ogun, and Abuja, we actually locked down for 5 weeks. But as you can see, after relaxing the lockdown, some aspects of the compliance really went down. So why have we taken some of the decisions we've taken? Well, in the first place, it's not possible to do a generalized lockdown of the whole country again. That would be very difficult, not only to implement, but it will also be very damaging to the lives and well-being of the country. So we have to look at alternatives. What we're trying to do is to take out the small fires that are currently raging in different parts of the country. We know that a small number of local governments within certain states are responsible for the majority of the infections that we currently have. And what?
Okay, Dr. Sani Aliyu.
Towards these areas. The decision about relaxing the interstate movement was a pragmatic one because we all know people that have been traveling in between. Over time, it's natural when you have a pandemic, people start getting fatigued and not complying. So, which was why we had to relax the interstate restrictions because we knew that they were not being followed. And based on the modeling that we also have, we know that overall it will not significantly change the total number of cases we have in the country. It might slightly change the distribution, but certainly not the total number. The main challenge we are having with the response is really the level of compliance with people in the country. And this is where risk communication, public awareness campaigns is really critical because people need to change their perception of risk. If I know that if I go out, I'm at risk of endangering my own life and that of my loved ones, I don't even need any level of enforcement to know that I need to wear masks, for instance, to know that I need to avoid mass gatherings, etc. But the PTF will continue to work very closely with the state governments. We're not saying we are handing everything completely over to the states, but what we're saying is we're going right down to the community and the grassroots level, working with the state governors and our partners to make sure we get on top of this problem. And we'll continue to monitor things very carefully. Finally, the other thing I wanted to say is we're still in the exponential phase. As we all know, our testing numbers in the past have been low. We knew almost certainly that there were more infections in the country than we were measuring. I'm glad to say that we've opened up a lot more laboratories in the country. The number of cases has gone up proportionately because of the increase in the number of testing. But that's the right way to be able to find out where the problem is. And we'll continue to work and support all those that are involved with the response to make sure that we get on top of this problem as quickly as possible. Thank you.
Dr. Sani Aliyu, there's a spike in the numbers of COVID-19 cases in Nigeria. We have so many molecular laboratories now to test people. My question is, how difficult is it and overwhelming is it to make Nigerians aware that COVID-19 is real and they need to take precautionary measures? How difficult and overwhelming is it for the PTF to do that, especially with the sub-national entities and local government areas? How do you come about that?
So the key thing is to realize what are the common methods of communication. Most of our people usually listen to radio, and they also listen to their religious leaders and their traditional rulers within the communities. We have been doing a lot of work at that level. We've been working with the National Orientation Agency that has a presence in virtually every local government. We've had activities in virtually every local government where people have gone around, including village town criers, including people setting up shop and providing public awareness campaigns locally. But of course, it's normal because you have a high variation when it comes to literacy. You also have an issue of trying to balance very restrictive measures that are culturally very difficult to accept, that are very different to what we are used to, what I would call possibly antisocial measures. But we know they are the only measures that would actually help in terms of stopping the transmission. So yes, it is challenging. We are changing a number of approaches. So, for instance, one of the reasons why people don't believe, they keep on talking about not having seen any COVID patients themselves. So we will be putting forward, I'm sure you've seen some of the clips and video clips online, etc. We will be interviewing people that have survived COVID, or those that have lost loved ones to COVID, to come out and really talk publicly about this issue. Of course, stigma and discrimination continues to be a major part, a major barrier to people accessing testing. Because for some parts of the country, actually our challenge is not necessarily the availability of test kits, etc. No.
I just wondered, Dr. Sani Aliu, if we still have access to you, I would like you to respond to this, because we had a freeze a moment ago. Now, there is resumption of interstate travels, except, of course, at night. Kogi State is a junction state in Nigeria, bounded, as it were, by some 10 states and then the Federal Capital Territory. In Kogi, we have also seen what some persons refer to as the unbelievable denial of the existence of COVID-19, oftentimes from the highest quarters in that state. And we have also seen a number of high-profile deaths in the state. And it is also in the air that one of the individuals who demonstrated in Kaba against the existence of COVID-19 is himself probably in isolation now. Will your committee consider Kogi a state of interest? And if so, what are you going to do, considering that there are probably a crisis just waiting to explode in that state in respect of COVID-19?
I think Kisley is like it's frozen.
Oh, all right. Okay, so whatever it is, we'll keep that question in the air, and then we'll get Dr. Sani Aliu to respond to that when we do come. I'd like to bring in now Professor Morris Iwu, who is also via Skype, so let's get through with the Skype connections once we are okay. If Professor Iwu is on, we could bring him in. Professor Morris Iwu, you're chairman of the Imo State Task Force on COVID-19. Excuse me. We had you on the program sometime in the past, and you did outline the measures that the Imo State government was taking in terms of provision of isolation centers and bed spaces. But it would appear that between the last time we had a chat with you and now, the numbers have risen in Imo State. What explains this, and what have been the responses?
Yeah, we just started testing more cases. We now have about 1,500 tested. Earlier on, we didn't have a testing center here in the state, and we now realize that the more people we test, the more positive cases that we found out. But based on what the PTF has just come out with, what we are doing now is we have activated by Thursday the other pillars, namely the people in the transport, the people in the hotel business, the markets, and the whole idea now is to be able to curtail the community-based spread. so that we can have a curtailment of the spread of the virus. So there's nothing really that we did not anticipate. We knew that by the time we test more people, that we'll be able to have more cases. And this is exactly what is happening. We are testing far more than we are doing before. Our target is to be able to test about 100 people a day. And as we test them, then we'll be able to get many more positive cases. But the important thing is that there are measures on ground, like was said earlier. The important thing is for people to show up, to be tested. And if they are tested, it is not a death sentence, that many more people have been found negative after treatment than those that actually died from it. If actually in our state, we have only had about 2 direct deaths attributed to the coronavirus. Others have been treated very successfully, and they went home. So we are trying to pass on the message that it's very, very important that we get to know number of people who are infected so that they don't spread the disease to other people without knowing it. And we're also trying to curtail the so-called super spreaders, namely those who go to weddings, funerals, markets, and so on. I think with the PTF announcement now, a lot of onus is on us to be able to strengthen the existing system that we have in place. As I said on Thursday last week, we activated certain extra pillars to be able to help us in curtailing the virus. That's what's happening in the state right now.
Okay, Professor Morris, we're going to have to pause you where we understand our Skype connection to Dr. Sani Aliu is back. Dr. Sani Aliu, let me assume that you didn't get the question I posed earlier, so I will just recast it, even in paraphrase. I'm saying that now there is a resumption of interstate travel other than at night. Kogi State is a junction state bounded by some 10 states and the Federal Capital Territory. And in Kogi, there is what some persons have referred to as the unbelievable, even bizarre denial of the existence of COVID-19. And of course, we have also seen a number of high-profile deaths of personalities from Kogi, the latest, of course, being the chief judge of the state. And one of the persons who was said to have demonstrated against the existence of COVID-19 in Kaba is said to be already in isolation, apparently on account of COVID-19. Will the Presidential Task Force consider Kogi a state of interest, as it did with Kano at some point? And if so, what are you going to do?
So we continue to watch the situation in Kogi very carefully. There are discussions that are still ongoing between at the federal level with the state government in terms of how we can deal with this issue. Yes, we know that there are cases in Kogi. There's no doubt about that. We also know that we have not stopped looking. The NCDC is very much linked to what is going on not only in Kogi but other parts of the country as well. As far as we are concerned, we have lifted interstate movement because it's been happening anyway. The cases that have been coming up are cases that people will still present to those hospitals. We'll be working towards making tests more easily available at the community level. So we've got the gene expert machines, which even though they have a low volume capacity, but the advantage is we're able to bring the test much closer to the community so that we can know what's going on. But in terms of your question, Kano and Lagos were very different to Kogi, really. We do not have the same number of either mortalities or reports that we have seen in Kano and Lagos, which required a different level of intervention. But that doesn't mean that the federal government will not continue to work with the state authorities in Kogi to make sure that we continue to monitor the situation very closely. And Kogi is not the only state, of course, that is not testing. We know that there are other states in the federation that are not testing as much as we would like them to. And the only way you would know whether you have a problem or not is by testing. And the thing with COVID is you just cannot hide from it. You cannot wish the problem away. Eventually the issues will crop up, whether you like it or not. Especially in a situation where the general public are not following the guidelines, the protocols that we have set. So I will continue to work very closely with authorities beyond just Kogi, but also in other states that might have similar issues in terms of access and surveillance. But as I've always said, there is no shame in having COVID. There is no shame for a state to say we have high numbers because it means we are actually tackling the problem. Yeah. So that's what I have now. We'll see how things continue to progress over the next few days. As
Dr. Ali, Sani Aliu, thank you for your contribution. We'll get back to you in the course of the program. But we are now coming back to the studio where Professor Nasidi is here as usual. You've traveled across Nigeria in the course of, being task force of the COVID-19 ministerial task force. Can you tell us a bit of what is going around the countries, especially in the sub-entities and local government areas? You talked when we were here the last time about community transmission. That was before it even started. What is the assessment of the situation on ground now?
Well, the situation on ground, unfortunately, as we predicted and mentioned last time, is not as good as we would have loved it to be. The virus has escaped into the community and is spreading wide, unfortunately, beyond our expectation. And this is happening virtually in all the states. And there are states that are a little bit more serious. And the worst thing is that we are not having a national front against this epidemic, as we had with the Ebola period, where all governors, all states, everybody came together, Nigeria united, and we faced that disease and knocked it off. Here we are having a big problem of many states are in denial. Some governors are even vehemently against, declaring their states, to have COVID. Just like Sani Aliu said, there's no shame in having the COVID, and so as a result, they are truncating, the most important, tool we have to fight this disease when it's in the community. That is risk communication and community engagement. And then, of course, also, if you are not testing, that means you are not having the COVID, supposedly. So states and even countries in Africa that played around with COVID paid dearly. Some lost their presidents, some lost their top guys. So the governors that are playing these games in Nigeria should be extremely careful, because this is a disease that is worse than any other outbreak they've seen, with its ability to transmit quietly, because almost 80% of those who have the virus are not ill. They mix up, so they can easily transmit the virus to the innocent person who could be susceptible and who could develop the disease and die. There's also it's a disease that the moment you get it earlier, the moment you know that you have the symptoms earlier and you take yourself to the hospital, the chance of you to survive is more than 80%. But if you allow it, to go a little bit deeper before you go to the hospital, the chance that it will go into the severity stage is very high. Then lastly is the issue of investment. We are seeing all over the world, if very strong countries like US, UK, everybody, Europe, are very scared of this disease, and it has hit the economy beyond their expectation. And in fact, if you take the US, I don't know how many wars that they fought that has killed so many of their citizens like this virus. So nobody should play around with this virus. It's a killer. And now you can see how devastated those countries are, especially their economy. And so if you don't spend, wisely now to actually reach the people and let them know the danger of this disease, the cost, economic cost, biological cost, on any country on you will be much, much severe.
All right, Professor Nasidi, thank you very much. We'll return to you in the course of the conversation. Let's go over now to Kano, Professor Issa Sadiq Abubakar of Bayo University. Professor Issa Sadiq, give us your opinion as to what is playing out in our management, our response to coronavirus nationwide, and in particular in Kano. What is your research finding showing?
Well, thank you very much for having me. In Nigeria, we are fighting a war against a virus that is vicious, as the previous speakers has said, and we are witnessing a lot of efforts made by different stakeholders at national level, state level, as well as community level. But then there are variable amount of efforts being put by these stakeholders. This point has been made. We are having a strong presidential task force that continues to issue guidelines and is trying to reach out to so many stakeholders. But as the previous speakers have said, it's unfortunate that a war that everyone should be fighting in unison with all seriousness, all levels of seriousness, we are witnessing some that are not performing accordingly. And so that is why it's not surprising for anyone to see that the figures are rising. And I believe, just like the chairman of the PTF has mentioned yesterday, that for every single case, there are about 2,500 others that we are missing out. That is why we need to up our game in identifying the cases and then carrying out the necessary intervention. We need to be more serious and try to contain the epidemic across the country. In Kano, in particular, in recent times, we are witnessing an increased number of sample collection from the communities to the laboratories in Kano. Right now, the team is going to the rural areas of Gwarzo local governments. For the past 4 days, this is what we've been witnessing. I hope that this effort will continue, especially coming into the urban local government areas, because that is where the congestion is highest. So we'll want to witness more testing being conducted in urban more than the rural areas of Kano as well as other states. However, the number of samples have increased coming to the laboratories. The only other thing, as I am advising, is for us to conduct this pari passu with the urban LGAs. Thank you.
I'm still staying with you, Professor Abubakar. Kano is a business hub, and with the easing of the lockdown and interstate travel now being allowed, how do you think Kano is going to contain the spread of COVID-19?
Thank you very much. In fact, this is why I made my last point, because I know the number of people trooping into Kano is up to the population of a massive state, or in some cases, some small countries. And that is why it's going to be an uphill task for the state task force. And I believe that discussions are ongoing on how to curtail the spread between those who are coming into town with their COVID-19 and those who are going to infect the people coming to Kano. It's going to be an interaction between a large population of people, some infected and some susceptible, that the state task force need to be up and doing. Specifically, I know the road transport is one area in which the state task force need to battle a lot, because there are so many motor parks and so many people come into these motor parks. And with the way that people in Nigeria are not taking this infection very seriously, I know that it's going to be a big war between those who will enforce the laws that have been brought in by the federal government on, for example, wearing face masks when you are in public places. In the motor parks, it's not going to be easy. And then another aspect that's going to be very difficult is in terms of the number of people that the buses and other vehicles will be carrying. It is said that they should reduce their capacity by 50%, and specifically for taxis, only 2 people are allowed. If you take Kano, for example, we have the Keke Napep, which we popularly call Adede Tasahu in Kano. If you go into town now, you will find out that instead of taking 1 person, you have like a minimum of 4 people, apart from the rider. Because even on the seat that the rider sits, another person joins him in sitting, and then you have a minimum of 3 people at the back. This is not social distancing, and social distancing is not respected here at all. And so the law enforcement agents will have a tough battle to fight in that area. And similarly, the wearing of face masks, and then ensuring that in all public places, such as the motor parks, and when the airports resume, maybe the airports may be a little bit better because the people who travel by air are more enlightened when you compare them with those using the road transport. But it's going to be a very tough battle, and I know that the government needs to do a lot if only we are to handle this situation. And then the issue of risk communication is another big area that we need to work very well so as to ensure that we contain the spread of the virus.
All right, Professor Sadiq, thank you very much. We'll return to you in the course of the conversation, especially with respect to the behavior change that is important in your domain. Let's bring in again the Dr. Sani Aliu. Dr. Aliu, now, quite aside from the so-called non-pharmaceutical responses to dealing with COVID-19, I mean, the received wisdom now is that coronavirus is going to be with us for a while. There are a number of candidate vaccines and candidate drugs being tried around the world. What is our own national response in terms of finding solutions to COVID-19? There are some reports a couple of weeks ago about the alternative medicine experts who had submitted their samples for analysis and validation. What do we know at this time as to what we are doing locally to also find a response?
So we continue to engage very closely with members of the international scientific community. As you know, some of the trials are happening in Nigeria, not the vaccine trials, but some of the treatment trials are being coordinated by the by NIMA, the Nigerian Institute for Medical Research in Yaba, together with some of the teaching hospitals. In terms of traditional medicines, etc., I believe there's a system that needs to be followed. As the Honorable Minister of Health said, some of the claims, we've already directed them to the relevant authorities for submission, including NIPRID, etc. I don't have details of that. But all I can say at this point in time is that there is no vaccine. There are vaccine trials taking place globally. It's unlikely a vaccine will be available in the next 6 months to a year. And therefore, the very non-pharmaceutical interventions that you mentioned earlier are the main tools that we currently have to fight this epidemic. We do receive, the PTF does receive a lot of requests, including samples of traditional medicines coming over to us for testing, etc. But this is not our role. We have a coordinating role for the response. Particularly those involved in medical research know the authorities that they are supposed to approach if they have a particular claim in terms of treatment, etc. And these protocols need to be followed fairly strictly because even though we are in an epidemic situation, but we still need to follow our laws when it comes to the use of medications. I don't have any additional information on the Madagascar drug or any other drug claim at this point in time. The Ministry of Health have received the drugs and they have forwarded them to their own MDAs for analysis. Thank you.
Sani Aliu, 4 weeks extension of the easing of the lockdown, and I would like to ask you, what do you expect at the end of 4 weeks?
At the end of 4 weeks, I would say that at the end of 4 weeks, we will continue to monitor. In fact, we're not even going to wait for 4 weeks. We will continue to monitor fairly frequently the numbers and what is going on. There is no doubt the numbers will continue to increase because we're testing a lot more. But there's also no doubt that people are not following the guidelines that we are recommending. And unless and until all of us come together, accept that there is a problem with this pandemic and do something about it, the numbers will not change, I'm afraid. And we might start seeing a lot more mortalities. And this is what government does not want to happen. I will plead with people to realize that this problem has not gone away. It's one of the reasons why we maintained the night curfews, because we need to keep that message that we are far from normal. This is a virus that you cannot predict whether or not it's going to kill you. Yes, the majority of people, particularly young people, will be all right. But we have seen deaths in 30-something year-olds in Abuja. The youngest person to die in Abuja was just 38, and he had no other comorbidity. We've had deaths in people in their early 40s, people who did not even have comorbidities. So yes, you could fall within the 80% chance of having a relatively mild infection. But you could also fall in the 20% chance of requiring oxygen and becoming extremely sick. And this is where the problem is. If I catch COVID today, I don't know where I would fall. And at the end of the day, we do have a responsibility, a personal responsibility for our own health and the health of others. And the earlier we start complying with these guidelines, the faster we'll be able to get on top of the problem. Unless we get on top of the problem, we will not be relaxing the measures that we have put in place, because the government cannot sit back and allow its citizens to be at risk and allow people to die unnecessarily because people are not willing to change their behavior. And my message to those that continue to deny that COVID exists, well, I'm afraid you cannot deny something that has already killed 500,000 people worldwide. We have over 500 Nigerians that possibly could have still been with us today. Some of us have had personal losses as a result of COVID. This disease is there, whether we like it or not. It's challenging every country in the world, and we need to sit up as a country and as people and face this squarely and understand that things are not going to be the same. The new normal, this is the new normal, and we will need to change our behavior in order to protect our loved ones.
Well, Dr. Sani Aliu, just before we let you go, I would like you, because you have also mentioned this, the management of comorbidities. Incidentally, on Good Morning Nigeria some weeks ago, while we were focusing almost on a daily basis on coronavirus, we had some specialists who joined us in a conversation, the cancer specialists, a nephrologist, and others who joined. And the question that arose was how to manage those comorbidities at an isolation center, where, for instance, you may not have specialists. I mean, if a person is undergoing treatment for cancer, are you going to have an oncologist come around to treat the person? Are you going to have a nephrologist take care of a kidney patient? So how has this played out? Because sometimes you also get to read in the media that, oh, perhaps what knocked out the individual was a comorbidity and not necessarily coronavirus itself. How are those with comorbidities being managed?
So we have different levels of care. When we started this response, we were putting people that were asymptomatic in bed spaces, in hospital bed spaces, partly because we didn't have sufficient isolation capacity. Since then, things have changed. We now have established community transmission. So in Lagos, for instance, if you have COVID and you are asymptomatic, you will be asked to stay at home and keep away from other family members, and they will go in and test the family members. But if you have a significant comorbidity, a lot of our teaching hospitals now have the capacity to manage COVID infections. We expect patients that are very sick will be managed appropriately in these teaching hospitals or paramedical centers. The vast majority will be relatively well or would have mild symptoms. As part of our hotspot strategy, we will be creating additional community, we're calling them community support centers rather than community isolation centers because of the stigma associated with this. And these community support centers will essentially be bed spaces where people can be brought in and be isolated from the communities so that as they get better, they will then be put back into the community, but we can interrupt transmission. But for those that have comorbidities, diabetes, hypertension, etc., right from the beginning, we do a risk assessment, and we are able to direct them to the relevant treatment centers where these facilities are available. Over time, what will happen post-COVID is, as we strengthen the health system, we will make sure that every federal medical center and every teaching hospital has the capacity to manage infectious cases by setting up treatment centers, infectious disease treatment centers across the state in every federal medical and teaching hospital, up to a 45-bed facility. And we do have the resources for this. We've already been working with the Federal Ministry of Health in terms of our case management pillar to start this process, so that it's not just COVID, but also things like Lassa, Ebola can be managed at the state level rather than having to bring people to specialist isolation centers. But there's no doubt the people that die from COVID, if you are elderly, if you have comorbidities like diabetes, hypertension, cardiovascular disease, if you are obese, these are the main risk factors that potentiate mortality. And they are the factors that we have to deal with. I'm pleased that increasingly a lot of the teaching hospitals have now stopped turning patients back, because this was something that really worried us. A lot of the deaths that we have seen in some parts of the country, as you rightly said, may not necessarily have been due to COVID, but it may have been because people are having difficulty accessing medical care for conditions that in normal circumstances they would have easily obtained care from hospitals. And I'm pleased that at least to a large extent the message has gone out to the medical directors that we will not tolerate any further deaths as a result of people being turned back. Hospitals are meant to be hospitals for taking care of patients. These hospitals need to put in place adequate arrangements so that they can make an assessment even for people that have come in with COVID, and then redirect them appropriately rather than denying them care. Thank you.
Dr. Sani Aliu, National Coordinator, Presidential Task Force on COVID-19. We hear you have so many other schedules and engagements. We thank you so much for coming on the program, and thank you so much for your input.
Thank you for having me.
We now go to Professor Maurice Iwo, Chairman, Imo State Task Force on COVID-19. Dr. Sani Aliu said this is the new normal. We are at the dawn of a new world order. Nigerians are saying it does not exist. As the ease of lockdown continues, can you tell us, is it necessary? Should the government test every other person before going to any health facility? Should testing be for everybody?
Oh, wow.
Okay, well, sorry, we sort of lost that, Kingsley.
Yes, we seem to have lost the audio. So that will come back. Right. Professor Maurice, who is joining us via Skype from Owerri, we will return to him momentarily. I saw Professor Issa Sadiq a while ago. I'm tempted to raise this question because we're discussing very serious matters. Professor Sadiq, in Kano, you recall, it's now a couple of months back, just while we were considering what was playing out in Kano, you had mentioned that in terms of social distancing, some people in Kano were not respecting social distancing. They were still playing football, and you had large crowds at the playgrounds, what they refer to as Corona Cup. But at some point, those matches were suspended. I was just wondering, with the return of La Liga, Serie A, and Premiership, have they also now resumed the Corona Cup and, of course, avoiding social distancing in Kano?
Well, the government has not come out to accept the fact that youths should go back to the football pitches to play football. However, the Champions League, La Liga, Premier League have returned on television. But then the government has said that although they have allowed those places to operate, they are trying to ensure that those who utilize those places are adhering to the guidelines given by the state government with regards to social distancing hand washing and the use of hand sanitizers as well as face masks during those matches. However, because I do not go out to watch football matches in those public places, I do not know to what extent that is being enforced. But I know that the state government has come out clearly to say that the operators of those places must adhere to those guidelines. My only hope and prayer is that people should accept what the government has brought out so that there will be a balance between ensuring that at least the youths have some degree of freedom where they will go and have fun by enjoying the football matches that they so much love. On the other hand, they have to respect the guidelines so as not to be in trouble with the infection. So I would like to continue to call on people, just as my friend Dr. Sana Aliyu has done, that government's responsibility to us is to ensure that it provides the avenue for our well-being while protecting us against all sorts of hazards. And in this case, we are talking about COVID-19, which is an infectious disease that if we do not take the necessary precautions, we can keep infecting one another, and it will not restrict itself to those who have visited those public places. It is very likely that after getting the infection from such places, we'll go back home and then infect our loved ones, our parents, our grandparents, as well as other people that are living around us. We may not be the direct victims of death or extreme suffering, but those who will come back and infect at home will be the victims that will suffer most. So I will also want to call on the government to ensure that since it has given some leeway to the youths to enjoy these privileges, but then the monitoring should be very strict to ensure that the people are adhering to this, so as not to be taken unawares while we are assuming that these people are respecting the guidelines by government, but they continue to allow the youth to gather in large numbers and the infection continues to spread.
Thank you so much, Professor Issa Aboka. Will be back here in the studio where Professor Nasidi is sitting. Do we have enough awareness? Is it enough? And is illiteracy playing a big role in, the spike in the numbers?
Unfortunately, we don't have enough awareness as we should. And this is because of the weaknesses in our risk communication and community engagement from the beginning. The response was as if it was from top to down. More activities at the top, and we didn't go down to engage those who should actually be motivated, to know that there is danger. Then, it's so crucial to know that most of the programs, including what the PTF is doing, are all targeted to those people like us that can own television, radio, this, and this will have worked effectively before the virus escaped into the community.
What kind of awareness should be out there now?
Now, the type of awareness that should be down there, we have to go back to the old style, because they don't, first of all, they are taking this, this disease to be as if it's an elite disease. They don't see at least people dying or getting sick, any sickness that comes, malaria and whatever. So I would like to propose that we should now start emphasizing using organizations like the National Orientation Agency, Federal Ministry of Information, State Ministry of Information should be empowered. This is the time to really empower them to go back to how to reach the communities through the leaders, religious leaders, doing this, local campaigns and talking to the people. We used to have what they call Majigi in Hausa and some parts, all these films, Nigerian filmmakers. This is the time to really bring them in, to engage those who we need to know that the danger is lurking around them. And I would just say that, another style is to also get the PTF to start, going down, not talking to Nigerians from Abuja. They say they have found hotspots. It would be nice for them to be shifting bases, go to those hotspots, and then make their presentation to the nation, get some of the governors to come and talk. And lastly, some of the important issues that the masses have been talking, we have not seen any patient. It's not real. We have not seen anybody dying from the disease and so on and so forth. All televisions worldwide, they showed their people that, oh, look at, we have our treatment centers all packed full with patients. Some are on the machines, they're dying. Nothing unethical in that. You don't need to show the face of the people and all this thing. But the Nigerian masses want to see, is there really evidence?
From what you're saying now, in terms of perhaps lingering disbelief among some Nigerians, I recall that when we were just as a country confronting COVID-19, this was in early March, you were our guest on Good Morning Nigeria. Is it possible that because the symptoms of COVID-19 are not the same as those of Ebola? In Ebola, you will see the hemorrhagic fever, blood is coming out. And, when a Nigerian sees trouble, that's when he knows that there's trouble. But if it's just somebody who is coughing, they say, what do you have? I said, I just could not get. So could that be a reason? But COVID-19 is just as deadly, if not now, deadlier than Ebola. Could that be the reason why we're having this lingering disbelief in some quarters?
Yeah, in fact, one of the biggest reasons why the people are disbelieving that it's not a real disease as we're saying, and they don't see the danger, is that almost 80% of those who catch the virus, as I said, are asymptomatic. But the key is that those who go into the severity stage are really sick, and most of the time, even the ventilators don't help, they die, they are critical. So if you watch what was happening in Europe and even China, they show the treatment centers, they show these people on the machine, and so on and so forth. So any disease that can frighten strong countries like America, like Europe, and also we should take it serious. But you don't blame the masses if you cannot bring to their attention as to why this is dangerous. I used to tell people, I said, look, this disease has everything. It has the symptoms of the bird flu that we were afraid of. It has Ebola component, which is severe, and malaria. So it is like 3 in 1. It's a real killer. So unfortunately, when it comes so light, and people think, oh, let me wait. Even yesterday, I had a case, that this man has been sick, he's having temperature and dry cough, and they took him to some 3 hospitals. They rejected him. They thought he's whatever. By yesterday, he's dead. So unfortunately, what is happening now is that this disease that we're taking to be as if is simpler than Ebola, is simpler, is now becoming a big killer at the early stages. Even in Europe and China and all this, the virus was like looking for old people to kill. It goes to people older than 60 years old with comorbidities, with diabetes or something, grab them and give them, severe form, and they die. But now, even from the report by the PTF yesterday, the number of people, the percentage of people dying is now about 60%, people aged between 30 to 40. So it's becoming more and more serious. So that's why we need to go back to the traditional way of reaching these people. Say, look, don't waste time. You have malaria, you have fever. Even if it is a joke, just go to a clinic. Let them see you. Then the second most important issue now is how do you relate the testing and confirmation of the results? And this is becoming a big problem. The turnaround is such a big problem. People will go, okay, they get tested, but the result doesn't come back early. It comes back 3, 4, 5 days. Like some of those that died in the last 2 days that I know, they took their sample, they tested them, they were very worried, their family said this could be COVID. Before the result came, they are dead. So these are some of the issues that we should start, really looking at.
All right. Thank you very much, Professor Nasidi. Let's return to Professor Morris Iwo, joining us via Skype. You see him there on the right side of your screen. Professor Morris Iwo, tell us something. We have seen a rise in some of the neighboring states of Imo. Ebonyi, for instance, I mean, suddenly you're having all kinds of escalation of cases there. Abia, Rivers, and of course Delta, which is far away slightly. But the interstate travels lockdown, it's been lifted. Do you anticipate a surge in the number of infections in Imo? And if so, what protocols do you have in place to attenuate this?
I think that is a genuine fear. We are concerned with the lifting of the interstate lockdown movement between states, but that also re-emphasizes the point about testing. Like Nasidi mentioned, one of the worrying things in some states, you hear about mysterious deaths. What's happening that people are tested too late, and by the time their result comes out, they are already dead. As Nasidi mentioned, the key there is to be able to know who is infected and who is not. So what we have put in place, as I did mention, is that we have already started a pillar that has to do only with transportation alone, so that people who are in buses and so on, and one of the cynical things they do, they carry the face mask with them. When they get to the police station, they put them on, and afterward, they'll take them out. Sometimes it is actually the driver who shares it to them and distributes it to them, and then they put it just for the police, and after that, they put it up. The whole idea of the risk communication, we have failed in that regard, namely that the average Nigerian does not believe that COVID-19 is real, and that is really a problem. If we had dramatized some of these things like was mentioned, and they see it on television and see it in real life, they would have been able to know that people are dying, and people are dying daily. And what is also sad, that it's totally avoidable. When you look at the demographics of those who died out of this disease, they are very, very clearly so that there are mainly people who are 60 years and above. There are many people who had existing ailments. And sometimes, unfortunately, health workers themselves, since there's no way they will know who is infected and who is not. So what we have done actually in our state is to activate these points and also to do more and more testing. You can never overemphasize the need to test to know who are actually having the virus or not. And we have also been able to do cluster analysis. We know 2 local governments where this infection is much more dominant. And what we need to do in that particular case is to be able to see how we can restrict movement from those 2 local governments to other parts of the state, and particularly the rural areas. We have banned funerals, and we are able to separate burials from funerals. People can go bury their people quietly without the fanfare of the normal, typical Eastern burial, where there's a lot of fanfare festivals and so on. We have also restricted church services and then mosques. People should not gather in big groups. Those people, both classes are actually what we call the super spreaders and super spreading events. So now that the borders have been opened, we have to be much more vigilant, because right now you cannot restrict people from moving, but they should, like the federal government has just said, if you don't have their face masks, you don't move. And if you don't have your face mask, you cannot go to any public places. If we can only comply with the laid down rules and regulations, things will be better.
Professor Morris Iwu, thank you so much. We'll come back to you for your closing thoughts before the program ends, but we'll take a break now. When we return, more on the discussion on the easing of the lockdown.
You're still watching Good Morning Nigeria live on the network service of the Nigerian Television Authority. Now, let's bring in again Professor Abdulsalami Nasidi. Prof, some weeks ago, Kano, as it were, was like a tinderbox on account of the many unexplained deaths, and you were then part of the federal government task team that went into the state. And ever since the activities of your task team, there would appear to be a reduction in the alarming incidents of unexplained deaths, and then the sense of alarm that was also raised at the material time would also appear to have been mollified. What was done right?
Well, the Honorable Minister of Health, on the directive of Mr. President, intervened immediately and put together a tag team, of experts that included even a permanent secretary, Dr. Sanim Gorzo, who is a public health officer, but PAMSEC, Commerce and Trade, and then brought teams of experts from Irua Specialist Hospital. Fantastic experts, young ladies and gentlemen that relay this. And so we went as a real tag team to Kano. And the first thing we did was to gain the approval and attention of the governor. Before we went, we heard, oh, the Kano is not serious about it, but we were shocked. When we arrived, we realized the governor was, in the avant-garde, he was in front, really pushing to make sure that Kano is out of this. So we worked in, unison with the Kano task force and, the federal task team. And what we did was to be very specific. We addressed the major problems. And the major problems was, why were people dying so, easily? And we realized most of the people dying were people older than 60, 65, and with comorbidities. So we did what we need to do to tell the people, say, keep your old people away. This disease could be, those who have diabetes, they could be dying from diabetes, but actually triggered by the coronavirus. Yeah. Then the issue of transmission, even among the healthcare workers. By the time we came, about five senior members of the task force to fight COVID-19 in Kano were infected, were in the treatment center. Then some of the healthcare workers in the laboratory and also were also infected. So we realized immediately that infection prevention control was not effective. So we put everybody together. We worked as a team. There was no federal, no state. All of us came together and, launched a massive training, for those who are treating, for those who are doing the lab work, for those who are, providing the risk communication and so on and so forth. And we ended up with, good two reports. That one, we helped them to reorganize their, response structure. Moved it from just 6 pillars to about 10. Which they are all happy, the state is very happy. Then the Irua people were daily, moving from the treatment centers to laboratories, everything. So by the time we were leaving, everything's stabilized. Till we left, from the time we started our action till we left, no healthcare worker again in Kano was contaminated. Case of deaths among, the elderly and all this, reduced by more than 80%. And so many things are really stabilized. I think things are very good there now. So, but the most important is to say leadership. The leader must accept, and lead, what do they call it? So that's how we managed to do the good job in Kano.
Okay, thank you, Professor Nasidi. Professor Issa Abubakar, Dr. Sani Aliu talked about, states taking more responsibility, and most of these testing sites are situated in capitals. Talking about primary health care, do you think that this testing sites should go to other places since the community transmission is getting very, very high?
Well, actually, in ideal situation, we should have the testing centers covering all nooks and corners of every state. However, considering the costs, it is not very possible. What may work for us is for each state to have zones within the states. For example, we have the senatorial zones. We can at least target to have a testing center in each senatorial zone in the state. The most important aspect that we need to increase is the number of sample collection sites. Because from wherever the samples are collected, if they are brought to the laboratories, they will be tested. So if, for example, we have a laboratory one laboratory, at least in each of the senatorial zones, but knowing fully well that the state capitals are where electricity is better, internet facilities are better, and other things that you need to make a laboratory functional, there is no harm in having more than one in the state capital. And then if you now have sample collection centers, it will not be too much if you have in every political ward of each state. So that once the samples are collected, then you look for the nearest laboratory that can handle the specimen. And that is what we should be targeting, so that within the shortest possible time, samples that are collected from a particular point A will reach the laboratory in no time. And this will help in solving the problem of some of the samples getting denatured as a result of harsh conditions of weather, transportation in an unhealthy environment and things like that. And so if they reach the laboratory and the laboratories work without waste of time, and then pass on the results to the state epidemiology team, which should decentralize also in the state, such that it will have branches in almost all the local governments. The results will reach the particular individuals from whom the samples have been taken without a lot of waste of time. Then we'll solve all the problem of delays and some people not getting to know their status until they lose their lives. And I think this is what we should be targeting. It's capital intensive to set up laboratories, so we will not attempt to say that all primary healthcare facilities will have laboratories, but then we should target as many as is possible so that we will have as many as we need, and then they will help us in identifying every single case, and then the interventions will reach the people in good time. Thank you.
Professor Isa Sadiq Abubakar, thank you very much there for your response. Once again, let's go via Skype to Professor Morris Iwu. Professor Morris Iwu, I mean, for the benefit of our viewers who do not know, you are a professor of one of the fields of pharmacy. Can you just tell us something with regard to whether or not you have any concerns about the procedure for validating local claims for either treatment or cure or otherwise of COVID-19? Well, we seem to have lost the audio connection to Professor Iwu. Professor Iwu, we'll come back to you to get your closing thoughts on that particular question. Back to, I don't know, if Professor Iwu's audio is back now. Yes. Professor Iwu, I presume you heard my question, so let's get your response, please.
Sorry about that. I was trying to explain that regardless of the source of the medicine, whether it is natural, traditional, synthetic, regardless of the source, it's a medicine, and it has to be subjected to rigorous scientific validation. What has happened in our own case that it has exposed our weakness in the system. This is a pandemic that has thrown the whole world into confusion. We should have been able to rise up to the test. What we did as early as February was to alert our country that this virus is real, and that there are cures for the virus and they can be treated. And what is also interesting, that the global treatment profile so far have been that they're using known antiviral agents, and the ones we are proposing fall into that category of things that were used earlier for Ebola, whether they worked very well or not. Favipara and the Redivir, they are not that good, but yet we didn't even subject our own to such a. That's one. Secondly, we do not even have the internal capacity to test for those drugs. So when we now say that the products have not been tested or they are not tested properly, tested against what? And that is really, as I said, it actually exposes our own weakness. That was why my group had to link up with National Institute of Health of the US, because they have the capacity, they have the capability to be able to test. If you subject these drugs to these our own agencies, ask them the hard question: do you have the in vitro facility to test whether those products have the claim that they say? They don't have. So how can you test what you cannot test? And that is actually the dilemma we are having. The NAFDAC and the other agencies, yes, they can then do the proper regulatory framework. What we have also done was to subject the product that we have proposed to the government through the rigors of scientific evidence. Now the lead compound is going through NAFDAC processes so that we can have it on clinical trial. But our problem is that people are dying, And that was why we did propose that the drug that is a dietary supplement that has already been listed by NAFDAC should have been subjected to some analysis. And the drug is, again, a T, so that it could have been able to be used for pre and post exposure prophylaxis, so that people who have the virus will not be able to replicate in their systems. The other issue that we also had that they're using a steroid in the UK. We also have equivalent things. One of them was the one developed here in Nigeria by the Nigerian Raw Material Research Council. That particular product is a statin, safer than what is being used in the UK. Such things should be subjected to the same level of test, and so that we'll be able to know what's happening. Science is not oracle medicine. All you want to do is to subject whatever claim that you have to rigorous science. But when you don't have the platform, you don't have the method, you don't have the capacity to do that, why claim or why dismiss something you don't know? That is, to me, is a negation where you don't know and you don't know that you don't know. And then you arrogate to yourself that the fact that you are testing. What are you testing? Are you testing something that you can understand? Are you testing something that you have the capacity? Are you testing something that you know how to develop? And so we have to be modest about these things and also subject these things to test. Right now, our only option would be that some of those selected products, ours wasn't one of them, that they should be put into clinical trials. Unfortunately, or I should say, the way science works is not democratic. So it doesn't have to be that you want to take one from each state or one from each zone. That doesn't work that way. So if we can remove the politics of it and then be able to save lives, I think we'll be better off for it. So far, what is happening is that whatever happens in Europe or in the United States, we copy it blindly. And then the copy and paste doesn't work in science, unfortunately.
Maurice, thank you so much for your contribution today on the program. We thank you for coming. And Professor Nasidi Abdusalam Nasidi, Provost College of Health Sciences, University of Africa in Bayelsa State, and Vice Chairman, FCT Ministerial Expert Advisory Committee against COVID-19. He is also the former Director General of Nigeria Center for Disease Control. Thank you so much for coming on the program.
Thank you.
Professor Issa Sadiq Abubakar, Director, Center for Infectious Diseases